Hello, this is Module 6 discussion board on opiate addiction. Opiate addiction is a major problem in the U.S. today. Some signs or symptoms of opiate addiction include jaundice, constipation, vision problems, vomiting. Some people may have weight loss, confusion, hallucinations. They may be forgetful, have anxiety or mood swings, social isolation, personality changes, or damaged relationships with their loved ones. Opiate addiction may be caused by a variety of factors. Individuals with prior emotional dysregulation, severe mood disorders, or anxiety may be likely to become addicted to the euphoria. People may become dependent on pain medications when a doctor prescribes them, which leads to addiction because the person may have increased tolerance to the drug. Some people may feel that the continued use of opiates is needed for daily living, which creates dependency. Other possible causes of an opiate addiction may be related to biological, psychological, and social factors, such as a family history of drug abuse, or unresolved trauma, or peer pressure. It is common that an opiate addiction may be concurring with disorders such as eating disorders, alcoholism, mood disorders, or other substance abuse disorders. Opioids, they act by binding to the opioid receptors on the neuron in the nervous system and the immune system. These receptors are the binding sites for the families of endogenous peptides which modulate several important functions such as pain, stress, GI activity, motivation, etc. The behaviors patients demonstrate when abusing medications that I have seen is they'll have like lethargy, they'll be yelling out. Some patients may have hallucinations. Prescription drug monitoring program is an intervention that I think will be effective for this issue. It detects diversion, abuse, and misuse of prescription medication. It also supports the access to legitimate medical use of controlled substances. Also, by using prescription drug monitoring programs, you're also educating the public, making them become more aware of this issue. Now, there's many, let's say, I have some experiences with patients with substance abuse. And how did I handle it? Well, I always learned that a patient's pain is what the patient say it is. So of course I'm always going to address the patient's pain. If the medication doesn't work, I try to explore other options. Maybe they might have some partake in physical therapy or occupational therapy to help with the pain or to help, with movement to help alleviate some of that pain. We always look at what the medications can do for the patient. What about the non-pharmacological interventions? So I try to look at the non-pharmacological interventions that will benefit for that patient. Some of the problems that I have encountered with patients who are dependent on opioids, they might have GI issues, with the constipation. They're more hard to manage as far as behaviors. They seem less satisfiable. Hard to talk to. Those are some of the problems that I dealt with patients on that have substance abuse issues. But overall, it's just a sad situation. Overall, once you become addicted to opioids, it's very hard, to get back on the right track. That doesn't mean we don't treat the pain, but I think finding other interventions besides pain meds should be used prior to, heavy doses of pain. Well, thank you for allowing me to participate in this discussion board. I look forward to you all responses. Thank you.